You guys are never going to have to worry about EKG interpretation ever again after watching this video. Hey guys, my name is Will, nursing educator inside Coursera, and today we're going to go over EKG interpretation, and you're going to go over every single one of these rhythms that they're going to ask you in nursing school. Now, let's not waste any of your time. Let's get right into it. Make sure you guys download our free EKG study guide that is available in the link in the description below, and it goes directly along with this course, so you can write notes and fill out what we're going over together. So first of all, what is an EKG? An EKG is an electrocardiogram that we use to assess a patient's rhythm. You may see it as EKG or ECG. They both mean the same thing. So when you're actually reading an EKG, what are you actually looking at? Well, you're actually looking at the electrical conduction system of the heart. So you see, the heart is a muscle, but the muscle needs electrical conduction to run on a rhythm. And as you probably already know, maintaining a rhythm is vital for life. All right, so let's take a look at the heart. We have 4 chambers, as we know. But let's look at the electrical conduction system. So first we have the SA node. The SA node sits on the top of the atrium of the right atrium, and it is the primary pacemaker. It runs at 60 to 100 beats per minute, so that's where we always see that the normal range for a heart rate is 60 to 100 beats per minute. That's because our primary pacemaker says so, the SA node. Then if we move a little bit further down on that right atrium, we see the AV node. This is considered the secondary pacemaker. Now this is 40 to 60 beats per minute, which of course, if the SA node fails, then we have the AV node that takes over. Then we have something called the bundle of His. This is the pathway from the atrium to the ventricles to stimulate a ventricular contraction, which then leads to the Purkinje fibers. Now the Purkinje fibers are terminal of the conduction system. So it actually sits in the bottom of the ventricles to conduct a ventricle contraction. Now, the normal range for a Purkinje fiber, so if we had the SA node fail, the AV node fail, then our last resort is those Purkinje fibers. They are 20 to 40 beats per minute. Now, let's take a look at the actual EKG rhythm itself. So you need to know P, QRS, T. Each one of these represents what the heart is actually doing. So if we look at the P wave, for example, the P wave means atrial contraction. Now, by the way, guys, they're going to use these words such as depolarization and repolarization. So you're going to need to know them, so write it down. Depolarization means contraction, so it causes the heart to actually contract. And then repolarization means relaxation, so that's when the heart actually relaxes. So think repolarization means relax. So that's just a good way to remember it. So once again, P wave. What does it mean? It means atrial contraction, atrial depolarization. So when you see that P wave, that's that first hump that you see here before the big old QRS. This starts the electrical conduction of the heart. And then we go on to the QRS. So a QRS is a complex that all means ventricular contraction or ventricular depolarization. So we have the Q first, as you can see here, and then the R, which is at the very top, and then the S, which is at the very bottom. So that all means ventricular contraction. And then we have the T wave. So the T wave is ventricular relaxation. You may be thinking, well, where's the atrial relaxation? Well, the atrial relaxation gets hidden by the QRS complex. It actually relaxes during that time, but you can't see it on an EKG rhythm. So remember, P wave, atrial contraction, QRS, ventricular contraction, T wave, ventricular relaxation. Now you may see something called a U wave. This is not very prominent most of the time, but you may see it in certain cases, which U wave would look like this. All right, so we know about the electrical conduction system and what the EKG rhythms actually mean. Now let's move on to actually how we measure an EKG rhythm. So you see behind the EKG rhythm, there's a bunch of boxes. Well, a bigger box that holds 5 small boxes, that equals 0.20 seconds. You guys are going to need to write these down, as this is vital for interpreting lots of different rhythms. So a big box, 0.20 seconds, that holds 5 small boxes, which each equal 0.04 seconds. Now, why do we even need to know this? Well, there are certain segments of the EKG rhythm that we really pay attention to. So we know about the PQRST, but there's also segments that we need to pay attention to, such as the PR interval. The PR interval, as you may or may not know, is huge on identifying heart blocks, which we're going to get into. The PR interval is the start of the P wave to the beginning of the R wave. A normal PR interval is 0.12 seconds to 0.20 seconds. So if you remember, 0.020 seconds is 1 big box or 5 small boxes. And then going on to the QRS complex is another one that we need to measure. The QRS complex tells us if there is a ventricular rhythm going on. If it's widened at all, we know it's a ventricular rhythm. So that's an easy way you guys can actually identify it when we start going over the rhythms later. But QRS complex, the normal range is 0.06 seconds to 0.12 seconds, so no larger than 3 small boxes. All right, the next one is ST segment. So this is not necessarily measuring the distance, but you're wanting to see what the ST segment baseline is. If it's elevated, as you may or may not know, may mean they have a myocardial infarction going on, or if it's depressed, same thing. So the ST segment is something you want to pay attention to because you may be questioned on your nursing exams, on your EKG exam. But if you see an ST segment that is elevated on your EKG exam, it's likely your answer with the myocardial infarction. And then the QT interval, which is not as commonly questioned about on your EKG exams, but it is good to know about. The QT interval, if that is prolonged, then it's related to something that could cause torsades de pointes, which we're going to get into as well. But no, the QT interval should not be longer than 0.04 seconds, which is 2 of those big boxes, or you could just say 10 small boxes. All right, guys, you already understand the basis of an EKG, so let's get right into how we interpret the EKG rhythms. We're going to go over all of the EKG rhythms that they could be testing you about in nursing school, and I'm going to show you guys how you can easily do it and identify them literally less than 5 seconds if you're really good at it. But if you guys haven't already, make sure you guys download our free EKG study guide, as you can write notes along with this video and it'll help better retain the information we're going over. All right, let's get right into it. There are 4 steps to interpret an EKG. Step number 1, let's start with the P wave. We want to find if there is a P wave. Now, you may know that atrial fibrillation, that's one of the most commonly talked about rhythms. They don't have a P wave, so we always start with the P wave here. So we want to look and see if there is a P wave, and the P wave should be present and upright in every single QRS complex, and it should be before the QRS complex. Now, as you may notice, the EKG rhythms come in pairs. So the P wave should never be alone without a QRS complex, and the QRS complex should never be alone without a P wave. So always make sure that the P wave is before the QRS complex and that there is also a QRS complex following the P wave. The P wave should never be absent or inverted or after the QRS complex. All right, step number 2, let's measure the PR interval. So measuring the PR interval is always important. You want to do this every single time. So all these steps, you want to do this every time. So we looked at the P wave, it's there. So the next step is to measure the PR interval. As you remember, the PR interval is the beginning of the P wave and then the beginning of the R wave. So it's measure that distance. The normal distance for a PR interval, once again, is 0.12 seconds to 0.20 seconds. So 5 small boxes. Now, once you measure the PR interval, let's go to step 3. Let's measure the QRS complex. So once again, with the QRS complex, we want to measure and make sure it's not prolonged or greater than 0.12 seconds or 3 small boxes. Now, if it's within that range, then we are good. Now, here's a good thing about this. If the QRS complex is widened, you can eliminate all of your other answer options and just strictly look at your ventricular arrhythmias. Because if the QRS complex is widened, then you can assume that it's a ventricular arrhythmia. Now, once again, the EKG rhythms come in pairs, so the QRS complex should always be following the P wave, so make sure you look at that as well. Now, step number 4, this is the step that gets most nursing students kind of confused, is how to actually measure what the rate is. We want to measure the rate in the rhythm. Now, most nursing schools use the 6-second strip method, where the strip is assumed to be 6 seconds, and you just count the QRS complexes in that strip, and that is your rate. So that's the easy way to do it. That's how most people do it. Now, if your instructor does not verify with you that that is how they're going to do it, if they don't verify that your strips are 6 seconds, you can also use something called the big box method. Now, to use the big box method, you want to count the number of big boxes in between your R to R interval. So as you guys can see here, you have your R intervals here, and then you want to count the big boxes. So here we have 1, 2, 3, 4, 5, 6, 7. And you have 7 big boxes, and then you use 300 divided by that number. So in this case, it's 7. So the formula is 300 divided by that big box number, and that is your rate. Now, once again, guys, most nursing schools, I can't say every, but most nursing schools use the 6-second strip method, where you can just count the number of QRS complexes that are within your strip, and that is your rate. So for example, here, we're looking at the same example. We have 1, 2, 3, 4, 5 QRS complexes, and it must be complete QRS complexes. So if one gets interrupted, it's like at the very end, that doesn't count as a rhythm. So you just want to count complete and full QRS complexes. So in this example, your rate would be 50 beats per minute. And then moving on to rhythm. So we measured the rate, now we want to measure the rhythm. This is still step 4. Measuring the rhythm is much more simple. You want to just count, once again, in between your R to R intervals, those should always be the same. So we checked with those big boxes here that there's 7 big boxes. Now the next R to R interval right next to it should also be 7 boxes. Now you do want to make sure too, if there's just a little bit off, that is considered arrhythmia. So it's not exact rhythm, so it should be exactly the same. So in between each of those R to R intervals, that is how you check the actual rhythm. All right, guys, so I know that can be a little difficult to understand, but don't worry. We're going to show this example, these steps, in every single one of these rhythms that we're going to go over. So you guys will be a pro by the time this video is done. All right, so these are the categories that you guys need to know for every one of your EKG exams. There are 5 categories. So there's 1, sinus rhythms, 2, atrial rhythms, 3, junctional rhythms, 4, ventricular rhythms, and then 5, heart blocks. Hey guys, it's Will Kirkpatrick, nursing educator in Psych Coursera. I wanted to let you guys know that I will help you with anything you need at any time if you just send me a text at 940-218-4062, 940-218-4062. Let's get back to the video. Now let's first start with sinus rhythms. Now sinus rhythms, your options are normal sinus rhythm, so this is your normal rhythm. And then we have sinus tachycardia, sinus bradycardia, and sinus arrhythmia. All right, guys, so normal sinus rhythm, there isn't much to say here. This is the perfect rhythm. This is the normal rhythm that we want to see with our patients. So it's everything that should be matching up correctly with normal sinus rhythm. So if we go over these steps, let's look at the P wave. Is it upright? Is it in front of a QRS complex? Is it ever absent? Those are all incorrect there. So as you look here, the P wave checks out, the P wave's fine. So let's move on to step number 2. Let's measure the PR interval. So once again, the PR interval should measure between 3 to 5 small boxes. And as you guys see in this example, the PR interval is 0.16 seconds, which is 4 small boxes. So this one checks out once again. And then step number 3, let's measure the QRS complex. If we measure the QRS complex, you guys can see here that it's less than 0.12 seconds. So we don't have any worries about ventricular arrhythmias. And then step number 4, let's measure the rate and the rhythm. So normal sinus rhythms, this is the most important because normal sinus. Now when we say sinus, remember the SA node, it's primary pacemaker, everything should be normal. So everything's normal except for the rate or the rhythm. So step number 4 is where you're going to find out and determine between your normal sinus rhythms. All right, so the rate. Let's look at the rate in this example. Let's use the 6-second strip method, as this is going to be your most commonly one that you use in your nursing school. As you guys can see here, if you count, there are 9 QRS complexes in this strip, and that means the heart rate is 90 beats per minute. Now we know normal sinus rhythm, 60 to 100 beats per minute is a normal heart rate. This is normal sinus rhythm. Now we have one more thing to check. We need to make sure that the R to R intervals are the same, because here's the trick. It could be sinus arrhythmia. Now, sinus arrhythmia, which we'll go over a little bit in more detail in a second, sinus arrhythmia is characterized by inconsistent R to R intervals. As you guys can see here, we measured the R to R intervals, and it is the same throughout the entire rhythm. So we can say this is normal sinus rhythm. All right, moving on to sinus tachycardia. Let's go through those steps once again. Step number 1, P wave. Is it upright? Is it in front of the QRS complex? And is it there? And that answers all those questions there. We see in this rhythm that the P wave is normal here. So let's move on to the PR interval. The PR interval, if we measure here, is less than those 0.20 seconds, because if it was prolonged, then we're going to start thinking heart blocks, but it's good here. Let's move on to step number 3, measuring the QRS complex. The QRS complex is less than that 0.12 seconds, your 3 small boxes. So that checks out as well. So it's not a ventricular arrhythmia. And then step number 4, let's measure that rate and that rhythm. Once again, these sinus rhythms are going to tell you the difference with step number 4. So let's measure the rate first using that 6-second strip method. We look here, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. That's greater than 10 because 10 would be 100 beats per minute. So this is 110 beats per minute, which is considered sinus tachycardia. Sinus tachycardia just simply means a fast heart rate. Everything else is normal, but the heart is just fast. So this is your sinus tachycardia. All right, now moving on to sinus bradycardia. Step number 1, P wave. It's upright, it's before every QRS complex, and it is there every single time. P wave's good. PR interval, we measure it, it's less than that 0.20 seconds, so the PR interval checks out. Step number 3, QRS complex. The QRS complex is less than that 0.12 seconds, so we are okay there. And then now step number 4, rate and rhythm. We measure the rate, it's 1, 2, 3, 4, 5. That is 50 beats per minute. That's less than your normal range between 60 to 100 beats per minute. So make sure it's not arrhythmia. So we measure the R-to-R intervals. It is consistent throughout the entire rhythm. So we know that this is sinus bradycardia. And then our last option with the sinus rhythms is sinus arrhythmia. So P wave is good. The PR interval is within normal range. The QRS complex is less than those three small boxes. Rate and rhythm. The rate here is 1, 2, 3, 4, 5, 6, 7, 8. That's 80 beats per minute. So our options now is either normal sinus rhythm or sinus arrhythmia. Now the difference here, guys, is the R-to-R intervals are inconsistent throughout the rhythm. Now you can kind of eyeball it by just looking at it, but you do want to measure. As you guys can see here, this R-to-R interval is 21. This one is 30 and this one is 26, so it's inconsistent throughout the rhythm. So this would be sinus arrhythmia. All right, guys, let's go to the atrial rhythms. So your options with the atrial rhythms is a premature atrial complex, atrial fibrillation, atrial flutter, or supraventricular tachycardia, or SVT. Let's first start with premature atrial complex. So a premature atrial complex really explains itself in the name that a atrial complex, which is a what? A P wave, is occurring before it really should. Now this occurs when an impulse actually starts in the atrium before the SA node. So this is why it becomes prematurely. So the highlights of a premature atrial complex is that the P wave abruptly interrupts the rhythm, and the P wave, of course, has a QRS complex still. Now everything's normal except the P wave comes, so then the rest of the rhythm comes a little early than it should. Now, premature atrial complexes are spontaneous. They're not really going to happen on a regular rhythm. And your baseline rhythm is most likely going to be regular. So you're going to have a regular rhythm, but you're just going to have a random PAC, also known as a premature atrial complex, that occurs inside your rhythm strip. So let's do the steps. Step number 1, let's look at our P wave. Is it upright? Is it before every QRS complex? And is it present? Those are all three checking out here. So let's go on to the PR interval. The PR interval is checking out. It's less than that 0.20 seconds, so we are good there. No concern for heart blocks. Step number 3, measure the QRS complex. The QRS complex is within normal range. It's less than that 0.12 seconds, 3 small boxes. So we're not thinking ventricular arrhythmias. Then step number 4, measure the rate and the rhythm. So we measure the rate. We have 1, 2, 3, 4, 5, 6, 7, 8, 9. So 90 beats per minute. This looks like normal sinus rhythm, except let's look at the rhythm. The rhythm is normal except for a spontaneous complex that occurs. As you can see on the 4th beat here, that is a premature atrial complex. Now don't get it confused with anything else such as a heart block, because the P wave still conducts a QRS complex and a T wave that follows. It just spontaneously happens, so this is considered a premature atrial complex. Now you'll typically see a longer P to P interval afterwards because the heart's kind of just trying to reset its rhythm. So the heart, once again, has a regular rhythm underneath. It just spontaneously has a premature atrial complex. So it's not abnormal to kind of see a prolonged little pause here right after a PAC. Now, many people can get this confused with heart blocks, but the biggest thing here is heart blocks will have P waves without a QRS complex attached to it. This one is not the case here. The P wave still stimulates a QRS complex behind it, so they're still paired up, so this is not a heart block. All right, let's go over the infamous atrial fibrillation. Now, for some reason, atrial fibrillation is really hard to grasp for some people, but it's actually one of those really easy rhythms to identify once you kind of understand what the characteristics are. So atrial fibrillation, what is it? It's rapid, uncontrolled twitching of the atria. And number 1 characteristic, it is highly irregular. So those main characteristics is no P waves, there may be F waves, which is literally stands for fibrillation waves, and it's highly irregular. So those R-to-R intervals are just going to be completely random. But there is no clear P wave that is upright or before the QRS complexes. It just looks like QRS complexes that are just floating in the rhythm without P waves. Okay, step number 2, let's measure the PR interval. Well, you can't measure the PR interval without a P wave, so that's automatically wiped out there. All right, so step number 3, let's measure the QRS complex. The QRS complex is still less than that 0.12 seconds, so those 3 small boxes. So we're not thinking any ventricular arrhythmias here. All right, so step number 4, let's measure the rate and the rhythm. So the rate here in this case is 1, 2, 3, 4, 5, 6, 7, 8, 80 beats per minute. Now let's measure the rhythm. Try to measure the R-to-R intervals. Every single one of those is not going to be the same, and you don't have any P waves. So what's those characteristics? No P waves. You may see F waves, and it's highly irregular. That's your atrial fibrillation. Now moving on to the atrial flutter. Now some people can get atrial flutter and atrial fibrillation kind of confused, but there's a very distinct difference here. As we talked about, atrial fibrillation is a highly irregular rhythm, while atrial flutter is actually a regular rhythm. So it's not irregular at all. The R-to-R intervals are consistent. There are going to be something called F waves though. So you're going to hear this in your nursing school. They're going to mention it as something that looks like a sawtooth. So these F waves are much more pronounced in atrial flutter. As you guys can see here, the presence here, they're much more upright than what you would see in a typical AFib. But don't let that be the determining factor for you. You guys need to measure the R-to-R interval to actually truly determine if it's atrial fibrillation or atrial flutter. So step number one, let's look at the P wave. Well, in this case, there's really not any evident P waves. There's a bunch of fibrillation waves, as you guys can see there, that are very sharp and upright. All right, so step number two, measure the PR interval. There's no clear way to actually measure the PR interval, so we're going to skip over that. It's not a heart block. And step number three, measure the QRS complex. That QRS complex checks out less than 3 small boxes, so it's not ventricular arrhythmias. Step number four, measure the rate and rhythm. The rate here is 1, 2, 3, 4, 5, 6, 7, 8. And then right here, this would be 80 beats per minute. Here's a good example. That QRS complex got cut off, so this is 80 beats per minute, guys. All right, so moving on to the actual rhythm, let's measure the R-to-R intervals. And as you guys can see here, another good indicator, if there's the same amount of F waves in between those QRS complexes, then you're most likely having a regular rhythm. All right, but let's measure it out. And as you guys can see here, the R-to-R intervals are consistent. So this is atrial flutter. All right, the last one with atrial rhythms is supraventricular tachycardia, also known as SVT for short. All right, so as you guys can see in this rhythm, this is a very rapid rate. So SVT is literally just characterized by that. It's a rapid impulse that is rerouted back to the same area over and over again, so it just stimulates a very rapid rate in the heart. So this is a somewhat common rhythm in the critical care setting, and it needs to be taken care of rather quickly because it puts a large demand on the cardiac muscle. The biggest characteristic with supraventricular tachycardia is that it is the heart rate is above 150, and it could also even reach up to 250 beats per minute depending on the age of the patient. But the biggest thing is here, guys, you need to know that supraventricular tachycardia is considered when it is greater than 150 beats per minute. Step number one, let's look at that P wave. It's really hard to tell if there's a P wave there because the rate is so rapid. So step one and step two are kind of eliminated because it's pretty hard to even identify a P wave because of the rapid rate. All right, so step number three, QRS complex. The QRS complex is still narrow, so it's less than those 3 small boxes, so we're not thinking ventricular arrhythmias. Step number four, measure the rate and rhythm. So if we measure this rate, you're going to find 250 beats per minute. Now this is a pretty extreme example. Like I said, if it's anywhere above 150 beats per minute, this could be supraventricular tachycardia. Now the rhythm is going to be consistent, so the R-to-R intervals will be consistent throughout the rhythm strip as well. So this is how you identify supraventricular tachycardia. All right, guys, so moving on to junctional rhythms. So junctional rhythms are pretty simple once you understand. There are 3 options here, and it's all due to the rate. So junctional is junctional, but the rate is what determines those 3 options. So you have junctional rhythm, accelerated junctional, and junctional tachycardia. All right, so let's start with junctional rhythm. All right, so junctional rhythm is characterized by an absent or inverted P wave. Now that P wave, another extra characteristic, might occur before or even after the QRS complex. So this P wave is pretty random, really, if you think about junctional rhythm. The junctional rhythm is, once again, going to have an absent or inverted P wave that is either before or after the QRS complex. All right, so let's look at this rhythm here. So let's start with step number one. Let's look at the P wave. All right, step number one is when you find out if it's junctional or not. Step number one, is it upright? Well, in this case, there doesn't seem to be a P wave that is upright. Is it inverted? Well, we don't really see an inverted P wave. It just looks like it's absent, which is a characteristic of junctional rhythm. So we have an absent P wave. Step number two, eliminate that because we can't even measure a PR interval. Step number three, measure the QRS complex. It checks out less than 3 small boxes, so it's not ventricular arrhythmias. And then step number four, measure the rate and rhythm. So this is how you determine the difference between your junctional rhythms. Once again, junctional rhythm, it is 40 to 60 beats per minute. Accelerated junctional is 60 to 100 beats per minute, and junctional tachycardia is greater than 100 beats per minute. And then if we measure the rhythm here, the R to R intervals are consistent throughout, so it is a regular rhythm. So really, what is junctional rhythm? Well, if you remember back when we talked about the SA node and the AV node, well, the junctional rhythms are actually the AV node taking over. So if you remember the baseline rate of an AV node, it is 40 to 60 beats per minute. So junctional rhythm is actually being controlled by the AV node, your secondary pacemaker. So that's how you guys can remember the pathophysiology behind it, is that junctional just simply means it's AV node. So when it's accelerated, that means it's 60 to 100 beats per minute, because the normal rate for the secondary pacemaker, the AV node, is 40 to 60 beats per minute, like the junctional rhythm. Well, when it's accelerated, it's 60 to 100 beats per minute. And then just like everything else, when we say tachycardia, that means it's over 100 beats per minute. So that would be your junctional tachycardia. All right, guys, so next is ventricular rhythm. So your options with ventricular rhythm is premature ventricular complex, so PVC, ventricular tachycardia, ventricular fibrillation, and then you have idioventricular rhythm. The highlight of a premature ventricular complex is that it is spontaneous and random of an impulse that starts in the ventricle before the next sinus impulse. All right, so it's a widened QRS complex that just interrupts the underlying rhythm. So as you guys can see in this example, let's use those steps for EKG interpretation. Step number 1, find the P wave. All right, so the P wave, is it upright? Is it before every QRS complex? And is it ever absent? And as you guys can see here, the P wave is checking out. So we move on to the PR interval. Measuring the PR interval, we can see that it's within normal range because it is less than that 0.20 seconds, so your 5 small boxes. Okay, so that checks out. So next, moving on to the step number 3, measuring the QRS complex. So as you guys remember earlier in this course that we talked about, the QRS complex is actually going to be telling us if it's a ventricular rhythm or not. So we're in ventricular rhythms now. So what does it mean? If you have a widened QRS complex at all through your rhythm, you can narrow out your options to ventricular rhythms here. All right, so the characteristic once again is that there is a random and spontaneous widened QRS complex that interrupts the rhythm and the P wave that's coming up next. All right, so as you guys can see here in this rhythm, we have the underlying rhythm here. It looks regular. And then we randomly have this giant widened QRS complex that just interrupts the rhythm. All right, so this is the characteristic and what it looks like of a premature ventricular complex. Now, most of the time, guys, in your EKG exams, you're going to have the underlying rhythm be part of the answer, and then it's going to say with a PVC. So you want to make sure that you interpret the actual underlying rhythm too. That way you can answer the question correctly. So in this case here, we want to measure the rate and the rhythm. So step number 4, where our rate is here, 1, 2, 3, 4, 5, 6, and then you do not count the widened QRS complex, so in this case the PVC, as part of your rate. All right, so let's start once again. So 1, 2, 3, 4, 5, 6, skip that big QRS complex, 7, 8, 9, 10. And then we don't count that big one again. So here our rate is 100 beats per minute. All right, so this answer, you might see this in your EKG exams, is that they're going to put the underlying rhythm in with your answer similar to this. This is sinus tachycardia with PVCs. So that would be your answer in this case. But really, guys, make sure you remember that and write it down, that you don't ever count the PVC or the widened QRS complex that spontaneously occurs as part of your rate. All right, next is ventricular tachycardia. This is a very famous rhythm that people talk about all the time in nursing school, and it's because it is a really critical rhythm. So you guys need to make sure you know how to identify it. But it's actually very easy to identify ventricular tachycardia. So ventricular tachycardia is defined by 3 or more PVCs in a row. Now, guys, this is very important. As you guys can see here, we have a very consistent widened QRS complex in this example, but take a look at this. We have another example of ventricular tachycardia, but it looks like there's an underlying rhythm, right? Well, as you guys can count here, there's 1, 2, 3, 4 widened QRS complexes in a row. That's greater than 3. So this is actually considered ventricular tachycardia on this strip. So make sure you guys write that rule down, that 3 or more PVCs in a row is considered ventricular tachycardia. All right, so let's get back into the characteristics. So let's go through those steps. Step number 1, find the P wave. Absolutely no P waves in this example. So step number 2 is also eliminated. Step number 3, measure the QRS complex. Well, if you guys measure that QRS complex, it's widened. It's greater than those 3 small boxes. So once again, that's how you easily identify it's a ventricular arrhythmia. So in this case, we do have that. And to measure the rate and the rhythm. So in this case, it's not as important to do step number 4 because we know that it's ventricular tachycardia just by the looks of it. But you can measure the rate, of course. That's always a good habit to do your steps no matter what. So if you measure this rate here, you get 180 beats per minute. Now there's some additional definitions that you might need to know and write this down. Monomorphic versus polymorphic. Monomorphic means one, right? So we know that there is one type of widened QRS complex. So this example is a monomorphic ventricular tachycardia because all of those widened QRS complexes look the same. Now with polymorphic, you're going to see a rhythm similar to torsades de pointes. Now we mentioned torsades de pointes earlier because it's related to a widened QT interval as well, because that's what causes the polymorphic. So there's more than one type of widened QRS complex. So you're going to see kind of an inconsistent appearance here with the QRS complexes. They're not all going to be the same size or same shape, and it kind of looks like they're winding into each other. So that is torsades de pointes, but it's just another version of ventricular tachycardia. So that may or may not be tested on your EKG exam. All right, so moving on to ventricular fibrillation. So ventricular fibrillation is also one of those rhythms that most people can just identify because it just looks like chicken scratch. There isn't real obvious widened QRS complexes. This just looks like there's random scratching on the EKG rhythm strip. So the characteristics, if we go through those steps, there's no P wave, there's no way to measure a PR interval. The QRS complex even is not able to be measured. So that's one of your major characteristics. If you can't measure a QRS complex, then it's likely ventricular fibrillation or, of course, asystole. But ventricular fibrillation is just uncoordinated and rapid twitching of the ventricles. So it's just like the heart muscle is having a seizure. So most of the time, the monitor is not even going to be able to get a heart rate. So this is a pulseless rhythm that you'll see here. And this, of course, is an emergency. And then the last one with ventricular rhythms is idioventricular rhythm. All right, so an idioventricular rhythm is characterized by a non-discoverable P wave, a widened QRS complex, and a rate of 20 to 40 beats per minute. Now, compared to your other ventricular rhythms, you guys notice that these rates are most likely high, of course, with ventricular tachycardia. But in this case, with idioventricular, the rate is slow. So this is what an example of an idioventricular rhythm looks like. So let's do those steps. Step number 1, find the P wave. There's no present P wave, so we can eliminate step number 2 because we can't measure a PR interval. All right, so step number 3, the QRS complex is widened. So we eliminated all the other options. We know it's a ventricular rhythm now, but let's look at the rate and rhythm. Step number 4. So if we measure out the rate here, we have 40 beats per minute. All right, so what is that characteristic of idioventricular rhythm? It is a rate of 20 to 40 beats per minute. Another little pathophysiology here. If you guys remember back where we talked about the SA node, the AV node, and the Purkinje fibers, do you guys remember what the Purkinje fibers rate is? It's 20 to 40 beats per minute. So idioventricular rhythm is related to the Purkinje fibers firing. Now this rhythm is a very big emergency as well. This is something that could lead into a ventricular tachycardia or a ventricular fibrillation, or of course an asystole. This is a rhythm that needs to be taken care of immediately. But if you measure out the rhythm, it's going to be consistent. So the R to R intervals are also consistent. So the biggest characteristics here, once again, no P wave, a widened QRS complex, and then the rate is 20 to 40 beats per minute. All right, guys, and today we're going to show you how to easily identify all of your heart blocks and make it very simple for you. And you can identify these in literally less than 5 seconds. The only thing you need to pay attention to is the PR interval. If you guys just simply single out the PR interval, you're going to understand how to easily identify all of your heart blocks, and you can literally understand it in less than 5 seconds. A lot of times people overcomplicate it. There's lots of other courses out there that try to explain it in different ways. But guys, I'm telling you right now, if you know the PR interval characteristics with each one of these heart blocks, it's extremely easy. And believe me, guys, this is probably one of the most talked about rhythms, and a lot of people have issues with them and struggling with them. But guys, I'm telling you right now, heart blocks are actually one of the easiest ones to identify. I'm going to tell you how. So your options with heart blocks is first degree heart block, second degree type 1 heart block, second degree type 2 heart block, and third degree heart block. So there's 4 options. Once again, guys, I want you to only look at the PR interval when you know it's a heart block. So let's get right into it. First degree heart block, what is it? A first degree heart block is the only heart block that will not actually have a complete block or drop of a QRS complex. So if you guys know that heart blocks literally means that there is a block from the P wave to the QRS complex. All right, so you're going to see P waves that are just there by themselves that don't actually reach the ventricles to stimulate a ventricular contraction. So that's what a heart block actually is. Well, first degree heart block is the only heart block out of your four options that doesn't actually get completely blocked, and it doesn't actually drop a QRS complex. So the main characteristic of a first degree heart block, once again, only look at your PR interval, is a prolonged PR interval. You're not going to see any P waves without a QRS complex following. So if you guys remember, the PR interval is 0.12 seconds to 0.2 seconds, which is 5 small boxes. So the characteristic of a first degree heart block is a PR interval that is greater than 5 small boxes. And once again, you should not see any P waves without a QRS complex. That is your first degree heart block. But for just the sake of it, let's go through those steps of EKG interpretation. Step number 1, let's find the P wave. Is it upright? Is it before every QRS complex? And is it ever absent? So you see that the P wave is checking out here, so let's move on to step number 2, which is what you need to look at for every one of your heart block interpretations. Step number 2 is determining the PR interval. All right, so let's measure it out. We see here that the PR interval in this case, in this example, is 0.28 seconds. So it is 7 small boxes. All right, but I don't see any heart blocks per se. There's not actually any dropped QRS complexes. So once again, that characteristic of a first degree heart block is just a prolonged PR interval. So that's what we got here. All right, so we have a first degree AV block. Let's make sure there's not any ventricular arrhythmias and so on and so forth. So step number 3 is measuring the QRS complex. It checks out because it's less than those 3 small boxes. And then step number 4, measure the rate and rhythm. The rate here in this case is 1, 2, 3, 4, 5, 6. So 60 beats per minute. We're using that 6-second strip method, which is the most common. All right, and then measuring the rhythm out. The rhythm here is checking out because it's consistent between each of those R to R intervals. All right, so this would be first degree heart block. All right, so second degree heart block type 1. This is also known as winky block. Now you might know already that a lot of people like to use the mnemonic longer drop winky block. All right, well that actually is a very good mnemonic. I'm not a huge fan of a lot of mnemonics, but that is a good mnemonic because it actually tells you what to look out for. But the highlights of a second degree type 1 heart block is that the PR interval is progressively getting longer with each QRS complex, and eventually it does cause a complete block. So you have your PR interval that's longer, and then looky there, you have a drop. So let's actually measure out the PR interval. The first one is 0.28 seconds. The second one is 0.56 seconds. The third one is 0.72 seconds. As you guys can see here, that PR interval is getting longer and longer, and then eventually you're going to see a P wave without a QRS complex, which is called a drop. So that is how you know that it is a winky block, because it's a second degree AV block type 1. All right, so if you go through this EKG step, all right, so step number 1, you look at the P wave. It checks out because it's upright, it's not inverted or anything, and it's before every QRS complex. And then you have step number 2, which is how you determine every heart block. We have the PR interval. As we just mentioned, second degree type 1 is characterized by a longer PR interval that prolongs over time and eventually causes a complete block. Step number 3, let's measure the QRS complex. The QRS complex is okay because it's less than those 3 small boxes, so it's not a ventricular arrhythmia of any sort. Step number 4, measure the rate and the rhythm. Our rate here is 1, 2, 3, 4, 5, so 50 beats per minute. And our rhythm checks out because the R to R intervals are consistent. All right, moving on to second degree block type 2. So this is also called a Mobitz 2. So what I want you guys to know, a lot of people get confused between second degree type 2 versus third degree heart block. This is where people get really confusing when they try to teach this stuff, but please literally only look at the PR interval. That is how you're going to know the difference. So the biggest rule I can tell you with second degree type 2 heart block is that the PR interval is always the same. All right, so don't look at anything else. I'm telling you right now, once you know it's a heart block and you're trying to determine, okay, which heart block is it? If that PR interval is always the same, and then there's also, of course, random blocks throughout the rhythm, that is second degree type 2, which we'll get into what third degree heart block is. But if you guys know that you're seeing random blocks throughout there, of course you're going to know that third degree heart block has random blocks too. But how you know the difference between second degree type 2 versus third degree is that the PR interval is always the same. So let's look at this rhythm here. We have blocks that, as you can see here, we're showing you highlighted blocks without a QRS complex. There's POAs by themselves. But look at the PR intervals throughout the entire rhythm strip. We have a consistent 0.28 seconds throughout the entire rhythm strip. That PR interval is always the same. All right, guys, so remember that. That's how you find out if it's second degree type 2. All right, so moving on to third degree heart block. As I said, this really gets confused a lot of the times, and how people actually teach it kind of gets really confusing as well. So if you look at the PR interval and only the PR interval, you know, here's the rule. PR intervals are never the same in third degree heart block. All right, so we know that we talked about second degree type 2 where it's always the same. Well, in third degree heart block, it's never the same. So it is literally that simple on how to determine second degree type 2 versus third degree heart block. All right, so as you guys can see here, there's blocks throughout the entire rhythm, right? But look at the PR intervals. If the PR intervals are not consistent throughout the entire rhythm, then you know that this is a third degree heart block. All right, guys, that concludes our EKG interpretation course. Once again, if you haven't already, make sure you guys download our free EKG study guide on our website on tactilevr.com. You can click on the link in the description below. Thank you guys so much for watching, and we'll see you in the next video. Hey guys, first of all, thank you so much for watching the video entirely through. It makes our day if we know that nursing school got a little bit easier after watching one of our videos. If you guys like this video, make sure you like it, subscribe to the channel for more, and drop down in the comments for any more ideas that you need help with nursing school. If you want to contact me personally, it's 940-218-4062. Thank you guys for watching. We'll see you in the next video.